Today's topic is inactivated vaccines. Let's briefly review the three major types of vaccines. First, live attenuated vaccines. They use weakened but living pathogens. Second, inactivated vaccines. They use killed pathogens. Third, nucleic acid vaccines. They deliver messenger RNA or DNA to make our cells produce antigens. Now, we'll focus on inactivated vaccines. Inactivated vaccines are made from non-replicating pathogens or their components. In a narrow sense, they are produced by inactivating the whole pathogen with chemicals, heat, or radiation.
Toxoids are sometimes included within the category of inactivated vaccines.
To understand how a dead pathogen can trigger immunity, imagine a taxidermy bear. A live pathogen is like a wild bear. An inactivated vaccine is like its taxidermy version. You can safely learn what the enemy looks like, and when the real one appears, you can respond quickly. Now, translating the taxidermy analogy into biology. Inactivated vaccines contain non-replicating pathogens whose surface antigens remain intact. Immune cells recognize them and activate B cells to produce antibodies. And some of these B cells become memory cells that stay in the body for months or years. This creates active immunity, enabling a faster response when the real pathogen appears. It mainly induces humoral immunity, while cellular immunity is weaker.
Inactivated vaccines have several important advantages. First, safety. They do not replicate, so there is no risk of reversion to virulence, unlike live attenuated vaccines. They are also safe for immunocompromised patients and pregnant women. Second, they are stable and easy to store and handle, which is practical for routine use and global distribution. Third, they induce strong humoral immunity that provides reliable protection. And finally, they are suitable for combination and co-administration. Because the pathogens are inactivated and do not replicate, they do not compete with each other in the body. So giving them together does not reduce immunity. Inactivated vaccines also have some limitations. First, they induce weak cellular immunity, so protection relies mainly on antibodies. Second, because the pathogens are inactivated, more antigen is needed to trigger immunity, which can increase reactogenicity and cause stronger local reactions. Third, they often require adjuvants to enhance the immune response. Fourth, a single dose is usually insufficient, so multiple doses or boosters are needed to achieve and maintain protection. And finally, they provide poor mucosal immunity, so they are less effective at preventing infection and transmission at entry sites like the respiratory and intestinal tracts. Finally, let's look at some common inactivated vaccines used today. These include whole pathogen vaccines such as polio, influenza, Japanese encephalitis, and rabies. Toxoid vaccines like tetanus and diphtheria are also inactivated vaccines. Recently, a 5-component combination vaccine has been introduced, including diphtheria and tetanus toxoids, acellular pertussis, inactivated polio, and Hib, a conjugate subunit vaccine. It is given in a 4-dose schedule during infancy. This allows multiple antigens to be given in a single shot, reducing the number of injections and improving vaccination efficiency.